Improving quality of life for residents with dementia. Behaviors. What is dementia? It's a deterioration of intellectual functioning and cognitive skills, such as memory, leading to a decline in the ability to perform ADLs. Both reversible and irreversible conditions. The reversible condition is infection, drug reactions, electrolyte imbalance, and nutritional deficiencies. The irreversible condition can be Parkinson's, head trauma, multiple infarcts, Alzheimer's, and Alzheimer's accounts for 50% of the irreversible type. Stages of dementia. Early, we have forgetfulness, disorientation to time and place, hesitancy with finding words for places, things, takes longer to complete basic ADLs, decreased safety awareness, does not acknowledge the need for help, becomes anxious easily, may have a tendency to withdraw, and benefits from structure, lists, routines, and schedules. Early stage strategies need to keep consistency. They don't like change. It can take at least 3 weeks of consistency and routine to show improvement. Many times when a resident is sent to the hospital and returns, they need to cognitively settle down with changes, otherwise it can exacerbate. At the end of the early stage and beginning of middle stage, they will begin to show cognitive impairment. Middle stage. Short-term memory severely impaired, unable to complete ADLs without assistance, repeats words or phrases, speech is slow, finger foods are good, strong preference for sweets, difficulty with coordination, may go to sit in a chair and may miss. Tunnel vision is 12 to 18 inches in front of them, makes repetitive movements, they tap, walking, picking at imaginary things, fiddles with the hands. Behavior catastrophic reactions become more common, may shut down. Sometimes they scream out. Does very well with old familiar routines and may take 15 to 30 seconds to respond. Middle stage, usually they're living in the past 40 to 60 years ago. Hoarding becomes a habit of theirs because they may have lived during the Depression. They connect visually and verbally, so be aware of your body language and tone of voice. Use short sentences. Redirecting will work for a short time, and always redirect with dignity and respect. They need validation, don't correct them. Reminisce. What kind of car do you have? What color? What do you like to cook? If they need an assisted device, they need to learn at the beginning of the middle stage. Late stage. May not be able to stand or walk, extensive assist needed for ADLs, may get combative, difficulty communicating needs, gets agitated very easily, may be incontinent, delayed thought process 60 to 90 seconds. The vision is like looking through binoculars, so their tunnel vision is 6 to 9 inches. So if you are standing on their far right or far left, they're not going to be able to see you because they don't see the full spectrum. Can take up to 30 seconds to respond, and they do not comprehend 75% of what you say. They are more prone to falls. They get postural changes, so at times they may feel as if they're falling. Speak to them while you're moving with them. Can become combative if you've rushed them, so have them hold your hand while brushing their hair, and always use the hand over hand technique. Stages of dementia for the end stage may be bedbound, total assist for ADLs, incontinent, essentially mute, requires assistance and cues for pressure relief in bed or wheelchair to prevent skin breakdown. Common types of dementia: Alzheimer's, which includes the memory loss, different stages, there are changes in ADLs, confusion. Parkinson's disease, difficulties with movement, difficulty initiating activities, and memory loss. And then Lewy body dementia, gait imbalance and slowness in movement, behavioral changes such as anxiety, hallucinations, inappropriate or impulse behavior, sleep disturbances, confusion, and eventual memory loss. Pain. Globally, it is estimated that 50% of elders with dementia experience regular pain. The prevalence of pain in elderly nursing home residents is 40 to 80%. Pain can impact behavior. They are not always able to express if they are in pain. Chronic pain increases with the shrinking of the brain, hyperactive nervous system. The comprehensive care plan, it involves the care needs for all involved disciplines, documentation that identifies the resident's problems, needs, and strength, and it's resident-centered. De-escalation. So what does that mean? Taking down to calmly respond, avoid a potential crisis. You need to listen, acknowledge, agree, apologize, and clarify. So you want to prevent something from happening. What is the one thing you can control in any situation? Actually go into the situation with the resident. Empathize. Resident may say, "Where is my mother?" You will start the conversation. "What is your mother's name?" Do not say she's dead. Remember your tone and body language at all times. What to control? Personal space. Many people don't want to share their personal space. Body language, supportive stance, and communication through gentle touch. Limited setting. Setting limits is not the same as giving an ultimatum. Limits aren't threats. If you don't come here with me, your weekend privileges will be revoked. Limits offer choices with consequences. The purpose of limits is to teach, not to punish. So be realistic and motivated. Setting limits is more about listening than talking. See the situation from the other person's point of view. Once again, empathy. Setting limits, explain which behavior is inappropriate, saying, "Stop that, may not be enough." Explain why the behavior is inappropriate. Don't assume they know. It is disturbing others, disrespectful. Give reason, choices with consequences. Allow time for resident to process, and you can redirect. Professional boundaries, why? Provides limits, produces consistency, defines power. Responsibility rests with the professional and provides credibility and predictability. Managing your own behavior and attitude. Don't take things personally. Be rational. We may not be able to control those precipitating factors, but we can control our response. Maintain professionalism and do not cross professional boundaries. Don't take the actions of others personally. Find positive outlets for your own negative energy. Behavior and attitudes of staff impact behaviors and attitudes of those in their care and vice versa. Name calling does not mean that is what you are. Please don't take any of this ever personally. Interactions and interventions. Modify the tasks. Reduce the number of steps required. Eliminate parts of the task. Focus on tasks that are familiar, repetitive, and gross motor. Once again, with interactions and interventions, limit choices. 2 choices. Do you want red or green? Don't offer choices when there is none. Do you want to take a bath? Instead, say, it's time for a bath. Present choices visually when possible. Communication. Move closer, speak slower with separation between words with a lower tone. Use short sentences. Give ample time for response before speaking again. Remember, it may take them longer to understand you. Eliminate as many distractions as possible. Avoid pronouns. Instead of say, pick it up, say, can you pick up the shirt? Always be patient, supportive, and friendly, and please listen. Acknowledging behaviors. Behaviors are a common symptom of dementia. This may be a form of communication. Behaviors have meaning and significance. It could be fear or pain, an inability to express an unmet need, a loss of sense of self, inappropriate expectations being placed on them. Addressing behaviors, repetitive questions, actions caused by severe memory loss. So look at the specific behavior. Are they asking about family? Are they asking about the next meal? Are they looking to go home? Can they carry a picture of the family with them? Will a large sign by the nursing station with meal times help? Are they hungry? Feed them. Is there any activity group to get involved with? Restlessness, agitated behavior. Reduce noise, clutter in the environment. Involve resident in an activity that involves some physical exertion. Refusal to bathe or groom. Keep to a schedule, a routine. Keep routine to a minimum number of steps. Provide rewards for complying, such as an afternoon tea. However, do not force anybody to do anything. Refusal to eat, keep to a scheduled routine. Allow plenty of time for completion. Don't rush them. Increase activity level throughout the day. Offer finger foods. Walk and they can munch. Rotate plate throughout the meal. Play calming music during mealtime. Pacing, toilet or offer the bathroom to residents before activity in groups. Incorporate exercise walking activity groups, and are they searching for a familiar item? Interactions and interventions regarding activity boxes and objects boxes. Activity boxes are a wonderful tool. While completing the task in an activity box, a resident with dementia has a sense of purpose and belonging. The most successful activity box is one that is designed by therapy for each resident's cognitive and physical capabilities. When creating an activity box for a resident, key points to remember include creating the resident's life story. Learn the resident's life story and prior occupations. This can be easily done by looking into the chart at the activity and social services assessment. Remember the dementia stages. Residents with mid-stage dementia are living 40 to 60 years ago in their mind. Mid-stage residents also like to fiddle with objects with their hands. Early-stage dementia are grasping onto life roles and hobbies as they have some sense of loss of cognitive and physical capability. Tasks for these residents should include hobbies and occupations in the past 20 years. Residents with late stage need items that are multisensory in nature, that provide sensory motor stimulation. The items in these activity boxes will most likely need to be completed by staff with the resident participating as able. Some activity box ideas are laundry kits, jewelry kits, a toolbox, game kits, and baby kits. Must match the right activity with their life activities and cognitive level. Addressing behaviors. Aggression. Shouting, hitting, pushing. Try to identify the immediate cause. What just happened prior to this? Focus on feelings, not facts. Don't get angry or upset. Stay positive and reassuring. Limit distractions. Check to see what's in their environment. Try relaxing.